Right into it. Welcome to this explainer where we take complex medical data and turn it into really clear, actionable insights. Today, we are tackling a massive medical mystery, chronic daytime exhaustion. I mean, if you've ever dragged yourself out of bed after what you thought was a full night's sleep, only to find yourself clutching your third cup of coffee by 10 a.m., feeling like you haven't slept a wink, well, this is absolutely for you. We're breaking down the 2026 Complete Guide to Sleep Apnea, and we are going to uncover exactly what is stealing your energy in the middle of the night, and more importantly, how you can get it back. So here is our roadmap for today. First, the silent sleep thief. Second, more than just snoring. Third, 3 types of apnea. Fourth, getting a proper diagnosis. Fifth, effective treatment options. And finally, number 6, the risks of inaction. Starting with Section 1, the silent sleep thief and the massive scale of daytime exhaustion. Why are you still exhausted? Seriously, you do everything right, you get into bed on time, the lights are out, you spend a solid 8 hours horizontal, but your alarm goes off and you just feel completely wrecked. You, or maybe your bed partner, might just be chalking this all up to stress, a super busy schedule, or, just getting older. But what if I told you there's an actual physiological mystery happening in the dark while you are completely unaware? 936 million. According to global health data, an estimated 936 million adults worldwide are affected by sleep apnea. That is just shy of 1 billion people. To put that into perspective, that's a staggering number of folks just walking around completely exhausted every single day. But here is the wildest part of the research. The vast majority of these cases remain totally undiagnosed. Millions of people are just suffering through their days, completely unaware of what is actively happening to their bodies at night.
So what is it? Sleep apnea is a sleep-related breathing disorder that causes repeated pauses in your breathing, or very shallow breathing, while you sleep. Basically, your airflow drops, your overnight oxygen levels plummet, and your body literally has to briefly wake you up just to reopen your airway or restart regular breathing. And this often happens without you even realizing it. Imagine someone violently shaking your shoulder every few minutes while you're trying to sleep. That stop-start cycle completely ruins the deep, restorative sleep stages your brain desperately needs to function.
Moving on to Section 2, more than just snoring, the 2 waves of symptoms. Look, when most of us hear sleep apnea, we instantly think of the nighttime signs, right? The really loud snoring, the gasping, waking up with a terribly dry mouth. But honestly, the daytime effects are where the real day-to-day damage is felt. We're talking heavy fatigue, morning headaches, intense brain fog, and just terrible concentration during meetings or when you're driving. And here is a crucial takeaway from the clinical guidelines. Not everyone with sleep apnea snores loudly. Actually, sometimes a bed partner just noticing that you're pausing your breathing, combined with you feeling terrible the next day, are the absolute best clues we have. So definitely don't wait for textbook saw log snoring to take this seriously. Section 3. 3 types of apnea. Unmasking the culprits. So it turns out there are 3 main types. First up is obstructive sleep apnea, or OSA. Think of this as a physical plumbing issue. The throat muscles relax and the airway actually becomes blocked or just collapses on itself. This is where you typically see the heavy snoring and gasping, and it's often linked to anatomy or excess weight. Then we have central sleep apnea, or CSA. This works entirely differently. The airway is perfectly open, but the brain just simply fails to send the normal signals to your breathing muscles. It's an electrical issue, usually linked to underlying heart or neurological conditions, and there might be very little snoring involved at all. Finally, complex sleep apnea is exactly what it sounds like, a mix of both obstructive airway blockages and central brain signaling events. This breakdown is exactly why a formal clinical evaluation is an absolute must. You really can't just guess which one you have based on how tired you feel. Section 4, getting a proper diagnosis. Let's look at the investigation process. So how do doctors actually figure this out? The diagnostic journey happens in 3 logical steps. Step 1, your clinician sits down and reviews your symptoms, both those nighttime disruptions and that heavy daytime sleepiness we talked about. Step 2, they perform a risk assessment. They need to decide if you can just use a convenient home sleep test or if your specific medical history means you need to be monitored in a formal overnight sleep lab. And step 3 is the sleep study itself. And look, this isn't just about watching you sleep. It is a hard data collection process. They are measuring your breathing events, your airflow, and exactly how far your oxygen levels are dropping throughout the night. Once all that data is collected, specialists classify the severity using what's called the AHI, or Apnea-Hypopnea Index. A normal score is under 5 breathing interruptions per hour. Mild is 5 to 15, moderate is 15 to 30, and severe is anything over 30 events per hour. Just pause and think about that severe category for a second. That means a person's breathing is stopping or dropping dangerously shallow more than 30 times every single hour they are asleep. That's essentially once every 2 minutes. No wonder their brain is completely exhausted.
Now, a really quick but critical clarification here. A lot of us wear smartwatches and fitness rings these days, and these wearables are fantastic tools. They can absolutely flag trends that might suggest poor sleep or drops in your oxygen. But, and this is a big but, they are clues, not clinical tests. When you need a real official diagnosis to build a treatment plan around your specific AHI score and apnea type, there is simply no substitute for a clinical-grade sleep test.
Section 5. Effective treatment options. Solving the case. The right treatment always depends on your specific sleep study results, but the good news, there are highly effective options available. The gold standard for moderate to severe obstructive cases is CPAP, continuous positive airway pressure. It uses a steady stream of pressurized air to essentially act as an invisible splint, keeping your airway wide open all night. Yeah, you might look a little bit like a fighter pilot while wearing it, but you'll finally sleep like a baby. But hey, it's not the only option. For mild to moderate cases, or for folks who just can't tolerate a CPAP, custom oral appliances that gently pull the lower jaw forward can work absolute wonders. Then you've got lifestyle modifications, weight-focused strategies, regular exercise, and positional therapy, which is basically just training yourself to sleep on your side rather than your back. And for certain specific anatomical issues, surgical approaches might even be considered. But honestly, here is what you really need to take away from this. Consistency with your therapy matters most. Buying a fancy CPAP machine and leaving it in the closet does absolutely nothing. The true secret to long-term success is working directly with your provider to find the exact right mask fit, tweaking those humidity settings you're actually comfortable, and building a nightly routine that you can stick to. It is all about finding a rhythm that integrates smoothly into your real life. Section 6. The risks of inaction. Why you really can't just live with it. We really can't ignore this. The compounding dangers of leaving this medical mystery unsolved are severe. Over time, those repeated overnight oxygen drops place intense, compounding strain on your cardiovascular system. This directly raises your risk of high blood pressure, heart disease, and even stroke. And beyond the heart, there's a very real, very serious risk of daytime accidents from sudden drowsiness behind the wheel. On a day-to-day level, untreated sleep apnea guarantees an ongoing decline in your energy, your concentration, and your overall mood. Heavy, chronic fatigue is not just normal aging, folks. It is a massive red flag from your body practically begging for help. There's a great quote from the source material that perfectly summarizes everything we've covered today. It says, "Treatment cannot start until the condition is recognized, tested, and matched with a plan a person can realistically stick with over time." You have to officially acknowledge the problem. Getting proper clinical-grade testing is the mandatory first step here. As they say, you simply have to measure it before you can manage it. So, I'll leave you with this final thought. Are you ready to finally get some real rest? If any of what we've covered in this explainer today sounds like you, or maybe someone you love, please don't just brush it off for another year. Take action. Consult a clinician, get a sleep study on the books, and reclaim your sleep, your energy, and your health. Thanks for joining me for this explainer, and here is to finally waking up refreshed.